Patient satisfaction to me means that from the minute the patient walks in the door, we make them feel like they're at home. They're the reason that we're here, so we want to make sure that they have a very memorable and positive experience.
So patient satisfaction means to me that a patient can walk in here in one mood and leave in a completely happy mood, recommend us to other people, and are willing to come back for our services.
Patient satisfaction to me is when the needs of the patient has not only been met but exceeds their expectations. From the moment we as care providers come in contact with the patient and their family until they complete the full cycle, including the billing of insurance and receiving payments for the care, we should treat them with the courtesy that we as individuals would expect if we were in their situation. As our mission statement states, we will promote and enrich the health and well-being of those we serve by showing the core values of hospitality and integrity.
In human resources, patient satisfaction begins with the hiring process. Many people have certifications, licensures, and all those things that folks need to take care of others in the healthcare setting. The people that we need to be someone that puts our customers first, someone that is compassionate, someone that goes above and beyond and realizes that our patients are in an uncomfortable setting, somewhere they don't want to be. So this needs to be a person and people that work here that are able to make our patients feel comfortable in an uncomfortable environment.
Well, I do have some insider knowledge of what our patient satisfaction scores are, but really patient satisfaction is more than just the numbers. So I would say the biggest test for me is to use the healthcare, which I do use the healthcare and the services here. So take a child to the doctor, sit with a grandparent on the floor, those kind of things, and you will see that our patient satisfaction is second to none. We have great staff, we have great providers. It's a great place. There's always room for improvement though, but as long as we keep the patient at the center of our workday, no matter what your job is here, we will always get better.
At Lucas County Health Center, we provide high-quality personal care involving not only patients but family or caregivers in decisions regarding patient care. Our nursing staff, physicians, and ancillary departments work together to provide the highest level quality of care possible.
I believe that patient satisfaction you can equate with the quality of the care the patient's getting. If they're getting good care, they'll be satisfied. And if they're satisfied, their attitude will be good. Their healing would be much better than what it would be if it was not.
Well, I think if our patients are satisfied with their care, number one, it makes them work harder, and that makes them want to get better. So we think around here it's kind of just the little things, like do you need a drink of water as they're working out, or we sometimes help them in and out of the front door, just trying to make them comfortable. Also, our patients are here sometimes 2 and 3 times a week, so we really get to know them really well, and I think that's a lot of their satisfaction is, we're kind of becoming like a little family. Sometimes they're here even 4 to 6 weeks. So that's kind of what we think is patient satisfaction. It's just the little things.
To go above and beyond for patient satisfaction to me means convenience. If a patient comes in for an exam or a test and they need something else scheduled instead of making them come back a different day to do the other tests, we can have them come in at that same time and do it. Saves the patient from extra waiting time, extra visits to the doctor, and hopefully they have a better experience.
It's very simple. You touch their hands, you hold their hands while you're talking to them, you put a hand on a knee or something while you're talking, you connect with the patient. If the doctor goes and gets them a warm blanket or a glass of ice water, that pleases them half to death. Period.
Well, out in the specialty clinic, we have patients that come in and sometimes they get confused and don't realize that the doctor that they're going to see is not there at that particular day and time. So we redirect them, and also sometimes they'll come in and need an appointment. And if we don't make the appointments, then Maxine will go ahead and call up to the doctor's office in Des Moines or wherever it is and have the patient talk and set up their appointment so that they can go home and be on their way. Also, I've seen many things happen out there in the specialty clinic, like family members getting upset because they have to wait, or filling out paperwork, and the staff tries to speed that up as far as helping to fill out paperwork, and as far as running late, we kind of explain what's going on to them so that maybe they'll be a little more understanding with us. And so I think if you have, patients who understand a few things about what's going on around them, that they're a little more satisfied with their care instead of not knowing and just kind of griping about it.
Going above and beyond for patient satisfaction means that we always do the right thing at the right time for the patient. It's hard because sometimes we have policies and procedures that are in place, and we really just need to focus on doing the right thing for the patient at the right time. It includes asking patients and families if there's anything else that we can do for them, and being able to follow through with that. Now, there's certain things they'll request that are probably impossible, but the little things are the big things while they're here. When we think about patient satisfaction, or when I think about patient satisfaction, I always think about giving a little bit more effort. And if we think about water, when water is hot, you can get up to 211 degrees, and that water is very hot. But when water is at 212 degrees, it boils. And so it's that difference that 1 degree of effort makes. And that's what really going above and beyond for a patient is about, or families, is just doing that extra 1%.
We're going to have more walk-in availability with the addition of more providers in the office to be able to see patients when they're needing to be seen. We're also going to have extended office hours into the evening hours, in addition to the mornings that providers here from 7 to 8.
I think we need to try to get our referrals a little speedier and get those patients in here and admit them, and I think they will be happier, because we've had patients call and say, I'm supposed to be doing cardiac rehab or pulmonary rehab, and we haven't received a referral, so we need to move those referrals right along, and we'll help that with the help of the doctors.
We continually focus on patient satisfaction at Lucas County Health Center. We're continually monitoring how we're doing in that area. We do that through the Press Ganey surveys. Our staff realize that patients can go wherever they want for their care, and all the more reason that we need to do the right thing and provide excellent customer service. It starts with the hiring process. We do let our candidates know what our standards of behaviors are. We've identified clearly in guidelines how we want to treat each other and how we expect to treat our co-workers, as well as how we want to treat our patients. And then it continues with the customer service training that we provide for all new employees. Our standards of behavior are again reiterated by our CEO, Veronica Foos, and then myself with customer service, giving clear guidelines on what our expectations are. We also have begun to ask our community what their needs are. Most recently, we've completed a community health needs assessment that asks the patients in the community what they'd like to see for programs and services to help them with their health care. And I think that's a great way to continue to provide great customer service. In addition, physician access is important. Our medical clinic, we've added a couple of new providers in the past couple of years, and we have 2 more providers that will be coming in the fall. Dr. Bogard is a medical doctor and will be delivering babies, as well as Amanda Bogard, who is his wife and a nurse practitioner. Both will allow us to see and meet the needs of the patients in our community. In closing, I'd like to say we will continue to earn the right to be your health care provider of choice, the one that you would recommend to others. And that always keeps it in the forefront of our minds. Our
desk is a mess. Is my desk on there?
Let me make sure.
Go ahead whenever you're ready, Albert.
Am I answering that same question that you asked?
Yes.
Can you edit this?
Yes.
Okay.
We continually...
Dang it!
Okay. Is someone that is compassionate, that treats patient satisfaction and customer, and I've already.
Either way is fine. If you'd rather look, some people are more comfortable looking at the camera, surprisingly. Some people are more comfortable looking at me.
Really?
I try not to look down because I know some people like looking at me, but I try not to stare at you too, so. The whole thing is just awkward, I think.
It is awkward.
So.
All right, I guess we'll do this.
Are you ready?
I suppose.
Okay.
Oh, Lana, just get off that topic.
Go above and beyond for patient satisfaction to me means... See, I forgot what I was going to say already. Now I can't remember what the word convenience.
Convenience, yes, there you go. All right. You want me to ask it again?
Yes.
Okay.
Okay, we gotta stop. So, do I say I feel, I think?
Whatever you like.
I never thought. I was like, huh.
You're like, how am I going to start this?
How do I start this? Okay. All right, let's try that again.
All right.
Way. It begins with hiring the right person. I did it so good the first time. We continually focus on great patient satisfaction. And get rid of the word great. I do have a hair appointment, Lana.